Okay, so good morning. Good morning, all. Dr. Yellow's got his camera on, fantastic. We really wanted to get into the nuts and bolts of a systematic review, since many of you guys will be doing a systematic review and, if possible, meta-analysis on various topics. So we wanted to reach out to somebody who has expertise in this area, experience in this area, who could give you kind of the Cliff Notes version of how to the nuts and bolts of it, essentially. So I'm very happy that Dr. Rachel Albright has agreed to join us here. She's in practice at in Stamford, Connecticut, for the Stamford Health System, just outside of New York. She's board qualified in foot surgery, board qualified in reconstructive rear foot and ankle surgery by the American Board of Foot and Ankle Surgery. Recently elected to the board of the Connecticut Podiatric Medical Association. She was APMA's Rising Star this year. She's recently become a section editor for JFAS. And her credentials are essentially, she's done a master's in public health at the Dartmouth Institute and spent at least 2 semesters working in meta-analyses, getting formal training in meta-analyses, systematic reviews. She's published in this area, pretty high-tier journals. So we're thrilled to have her here, and hopefully you guys can follow along or use this as a resource looking back on it during the next 12 weeks. So without further ado, Dr. Rachel Albright.
Yeah, thanks so much, Dr. Fleischer. I'm Rachel Albright, and I actually went to Scholl and was in your shoes not too long ago. So I'm going to share my screen with you here. See if we can get this to work. I am presenting to everyone. Great. Okay. So we're basically going to talk about systematic reviews and meta-analysis. I know that you had a quick run through just the last hour, but we're just going to jump right into it. So I'm going to give you a practical overview on how to perform these reviews. We only have an hour together, so it's definitely a Cliff Notes version. It's not going to be a comprehensive understanding of how to do it. There is some complexities and some complex things that can actually be a part of this, but I'm going to do my best to try to give you guys the most practical overview that I can so that you can do this on your own. So we're going to go through the search criteria, how to organize your data, how to analyze the data, and then briefly touch on how to present it with tables and figures. So how can a systematic review help us? Some of us might not know really 100% what systematic reviews can do for us. So let's just look at a quick problem here. So let's say you're a healthcare provider and you're dealing with patients that can get sudden sensorineural hearing loss. So what we know about this so far in our fake world here is that this is an idiopathic condition. We don't really know what causes it, and we're not really sure what the best treatment is. So we're going through the literature and we come across this study. It's a double-blind clinical study, and we're looking down at the results here, and it says that steroids had a statistically significant effect on the recovery of hearing in patients with moderate hearing losses. So as a healthcare provider, what are you thinking with this information? Well, for a condition that doesn't really have a current best treatment, I would say let's go for some steroids, because it looks like there's this double-blind study that has said that it could have some good effects. And this is oftentimes the issue that a lot of us healthcare providers are dealing with. There's not a lot of data on a subject, or maybe there's only 1 or 2 high-level studies. Maybe there's no high-level studies, and we're trying to make decisions in our practice on how to treat patients based on the literature. So sometimes we're wrong. So if you were a provider back then and you were using steroids, turns out that that's actually not the right thing to do. So this meta-analysis came out several years later, and the conclusions here say, despite the traditional practice in North America of treating hearing loss with systemic steroids, a meta-analysis revealed no evidence of benefit of steroids over placebo. So I think this is a good example of how a meta-analysis can really help us put into perspective all the literature and figure out what the best course of action is, because we're going to pool that data together and hopefully have a higher sample size and higher power to be able to do that. So I'm not going to get into really in depth the background behind systematic reviews, because I think you had a nice review last hour. But systematic reviews follow a clear pathway. And this was stated last hour. They're systematic. It's right in the name. There has to be a systematic process that you're following for how you're conducting these reviews. And this process is outlined not only in Prisma, but in the Cochrane Handbook. So these are great resources for you. This is not just a deep dive into the literature. So you're not just doing a review of the literature on a topic and then familiarizing yourself with the topic. It's comprehensive. You need to include all of the literature on the topic in your review. So it's not just a deep dive. Systematic reviews should include study characteristics and findings from each of the individual studies that are included. There should be a summary of the results in a systematic review. And sometimes systematic reviews lead to meta-analysis. Now, you can have a systematic review without a meta-analysis, but you can't have a meta-analysis without a systematic review. So your meta-analysis is your quantitative pooling of the results that you've gained from all the articles included. It'll increase your sample size and power. One point here that I forgot to mention, you need to assess the quality of the studies included. This is a requirement. Absolutely, you have to assess the quality of the studies included, and we'll go through later on why that's important. So meta-analysis, people use a phrase for meta-analysis. They say garbage in, garbage out. So with that in mind, can anyone tell me what the level of evidence is for meta-analysis? Just shout it out, because I actually can't see anybody. Does anybody know?
It's the highest.
Okay. Does anyone agree with that it's the highest?
Yes.
Yep.
Does anyone disagree? No disagreements. Okay, so that's actually a trick question. So a meta-analysis is only the level of evidence of the studies included in it. So does it have the potential to be level 1? Yes. But is it always level 1? Absolutely not. So if you have a meta-analysis of level 3 studies, then your level of evidence is level 3, and it is not 1 point higher than that. You can only achieve level 1 evidence with meta-analysis if you're including only level 1 studies in your analysis. So this phrase, garbage in, garbage out, is very true. If you have garbage studies in your analysis, it's garbage, right? I mean, you can't turn level 3 into level 1. So I think a lot of people believe that meta-analysis is level 1, and it always is, but that's not really true. It's based on the articles in your meta-analysis, so keep that in mind. So what you've already done to this point is hopefully identified a problem. Hopefully you've developed a well-defined research question, and now you want to find studies to answer your question. So some things that you probably have already done to this point is developed inclusion and exclusion criteria. This is pretty important, and it's going to guide your search and guide your analysis, and it should be developed a priori, okay? So it should be developed ahead of time before you undergo your search, and this is to avoid bias, and it's really important to do it ahead of time. This is not an iterative process. This is not a process that you refine as you go along. It's not like, let's look at the literature and see what's available and then kind of decide, and oh, okay, I kind of want to include this type of study, but I wasn't thinking about it before. It's not like that. You do it all ahead of time, a priori. However, sometimes you will review the literature and you're going to find that the studies you thought were available are not. And you have to redefine your inclusion criteria because you don't have a choice. You don't have enough studies. If that happens, then you document it and you have to reveal that upon publication that your inclusion criteria changed. So keep track of every time you change your criteria, but it really should be done ahead of time. So some things to consider is what study designs do you want to include? What population? Should the study have a control group? The maximum acceptable loss to follow-up. Now, this is something you should think about ahead of time. How much follow-up, or how many people can be lost to follow-up that's going to be allowed in your study? The minimum length of follow-up, blinding, other design requirements. So these are some things to consider. Some of you might be saying, how do I know what study designs to include? Many of you might say, I want to include only level 1 studies because I want my analysis to be level 1. And I hear you, and we all want that. But in foot and ankle literature, it's not always, you're not always able to do that. Foot and ankle literature is not very robust. So you don't always have that luxury of having level 1 studies only. So I would actually encourage you to include other studies that are not level 1, because you might have a hard time getting enough studies to do an analysis. So performing the search. This is definitely one of the most important parts of your review. It will make or break you. And if your search is not performed well, the entire accuracy of your study is compromised. So please don't cut corners on this. Please take the time to do it right, because if you do this right, then everything is going to fall into place well afterwards. So like I mentioned before, the search should be comprehensive. And how do we make it comprehensive? So we include a combination of keywords and mesh terms to form our search terms, and then that will help us make it comprehensive. You want to your search should be well documented, and this is for your Prisma diagram. So I did send out examples of Prisma diagrams ahead of time. You need to document every portion of your search because you will be asked to report on that later. We want to search multiple databases. These are just some examples of some databases that are frequently searched. Some of these databases require a login, so you'll have to ask your librarian or someone at RFUMS to see which databases you have access to as a student. And in addition, we might want to look at unpublished literature, so abstracts from conferences. A lot of these abstracts have really great data in it that's usable, but it's just not published in the literature yet, so that's a good place to look. References of studies might help you find new studies, and you can even ask experts in the field. So lucky for you guys, you're in a great place. You have all of your professors at school to help you, and they're all experts. So they can help you find some literature as well. I would highly encourage you to elicit the help of a librarian when you're performing your search. So I think you guys have some on campus. So I'm going to jump into performing the search. So hopefully you guys can see this. Let me know if you can't. So I'm just going to go to PubMed. So it's pubmed.gov is the website. And this is the main website you're going to see. Now I'm going to use PubMed because number one, it's free, and number two, everybody has access to it. You don't need a login for it. And this is the main page. You're automatically in the PubMed site. But I'm going to, you know what? Hold on. Sorry about that. Let me go to this first and go over this, and then we'll go into the search. We'll get there, I promise. So this is your search terms table. And everybody, in my opinion, should have a search terms table because it helps organize your thoughts. So if my research question is, does PIPJ fusion following hammer-toe surgery occur more consistently with KYs or implants? I'm going to use this research question to develop my theme. So it's a pretty simple table. You have your theme, your mesh terms, and then your keywords. Your themes are typically based on your research question. They don't have to be all the time, but it just makes logical sense. So hammer toe, this is my first theme because this is my population. So I'm looking at people who underwent hammer toe surgery. My second theme is going to be KYs or implants. So that's my intervention and my comparison group. And then arthrodesis is my outcome. That's the outcome I'm trying to evaluate. And then I'm going to use these themes to expand them into mesh terms and keywords. And then the mesh terms and keywords are going to be combined into the search term. So the theme is more of a reference point, but the things that are actually going to make your search term is your mesh terms and keywords. Okay, so now that we've kind of gone through that, let's go back to PubMed here. So now I'm going to find some mesh terms for that table. So I'm going to go to my drop-down menu and I'm going to click on mesh. Once you click on mesh, you're not in the PubMed database anymore. Now you're in the mesh database. Now, a mesh term is basically, it acts as a thesaurus, basically. You can actually click it down here as well. So it's actually kind of like a thesaurus, and you can see it's described as that too, and it indexes articles for you. So let's say I had no idea what mesh terms I should be using, but I know that my theme is hammer toe. So I'm just going to type in hammer toe. So here's the mesh term that comes up for hammer toe. It's not exactly the same. It's hammer toe syndrome. But this page gives you a lot of useful information. So it gives you a definition of the term. Okay, so you can read the definition, make sure it sounds right. These search builder options actually help narrow your search. So for systematic reviews, we are not going to do this. We are not going to use any search builder options because we do not want to narrow our search. These entry terms are basically the synonyms. So any of these words that are put into a title or abstract are going to be pulled by this mesh term. So that means you don't have to enter every single one of these words individually. In theory, you're just going to put in the mesh term and it will pull those words for you. Now, one thing to look at is the year this mesh term was introduced was 2003. So if you're looking at articles before 2003, like if you want to look from 2000 to 2020, over like 20 years, you do have to put these terms in because the mesh term is not going to pull it. So keep an eye on the year introduced and make sure that you're either searching within that time period and that's acceptable to you. And if it's not, then you actually do have to create keywords because it will not pull before 2003. Another thing to look at is the indexing. So this can be helpful. It's kind of like a branching system. It starts at the most broad term and goes to the most narrow term. Now you can see that there's no terms more narrow than hammer-toe syndrome, but the more broad term is foot deformities. So let's click on that mesh term and see what that is. This was in 1988, so it covers a lot more time. And these are, this is the indexing for foot deformities. So there's a lot of more narrow things under foot deformities. There's a mesh term called foot deformities acquired, and then even more narrow terms under that. And then these terms actually have their own mesh terms. They're actually their own separate categories. So this can be helpful if my research question was all forefoot pain or all forefoot deformities, because then I would just use the mesh term foot deformities. You want to use the most broad mesh term possible because, again, you want it to be comprehensive. You don't want it to be too narrow. But for the sake of our research question, we're going to stick with hammer-toe syndrome because we don't need bunions and all that other stuff. So I'm pretty happy with this mesh term, so I'm going to add it to my search builder. Now I want to look for other mesh terms. Now going back to my table, what we're trying to do is basically come up with all the synonyms that exist for our theme. What are all the ways authors could possibly talk about hammer toes? And we need to think of all those ways and report them in our search. So I'm thinking interphalangeal joint. Maybe somebody will say that. Interphalangeal joint. And it actually comes up toe joint. So there's not a mesh term, specifically interphalangeal joint, but toe joint looks to be right. Proximal phalanx, base of one distal to it, sounds fine. So this is actually a mesh term I'm going to include. If we go down to indexing, we see that plantar plate is also a mesh term, and it's one more narrow than toe joint. I'm going to stick with toe joint. If I go to foot joints, let's see how narrow or broad that is. All these things are included. It includes tarsal joints and subtalar joint and the ankle joint. So this is actually probably a little bit too broad. You're going to get a lot of extra stuff that you don't need. So we're just going to stick with the toe joint mesh term. We're going to switch it to an or, okay? And then we're going to add it to our search builder and then search PubMed. So this is just an example. You're probably going to keep going and examine any other mesh terms that could possibly be there for the theme of hammer toe. Now I go to advanced typically right away. And this shows the search that I just did, and it tells me how many items I found in my search. Now, when you're using your search terms table, you're using a combination of ands and ors in order to create your search terms. Ors are always across and ands are always down. So it's always going to be a mesh term or a keyword. And then it will be theme number 1 and theme number 2 and theme number 3. So if that makes sense. So that's why in my search here, I used or, and I got 1,600. Now for the keywords, you basically have to add in all of these keywords into your search. So I'm going to go back. So I'm not going to add them all, but I'm going to go in and do toe joint. Let's do toe, hammer toe. I'm trying to think of all the ways someone could possibly say hammer toe, and I want to make sure that I'm not missing anything. Crossover toe. Again, switching it to or, because these are just synonyms, just finding synonyms. So let's say we're fine with that. Press search. You're getting a lot more now, 28,000. This gives you a best match search order. You don't have to do that. it's not helpful for you here. Go back to advanced. And here's your search builder, okay? Again, it's the ORs. So when you are comfortable that you have all your mesh terms and all your keywords, you can add them back to your search builder, add it back to your search builder, and you're still gonna go OR, okay? So now you have your keywords or your mesh terms, and then search. Back to advanced. This is your final search term for your first theme, okay? So first theme is done because we did a combination of mesh terms, a combination of keywords, and we used OR in between. Now you're going to do that for the K-wires and implants, and you're going to do that for the arthrodesis one. Now I kind of pre-searched some things. I know that bone wire is the mesh term. There is no mesh term for K-wire or Kirschner wire, so I know that that's the mesh term to use for that, just for the sake of time. So here's the search kind of already done. So this is a little bit backtracking. So here's my mesh terms for my first theme. And here's my keywords for my first theme. And we're going to make them OR. So mesh terms and keywords put together with an OR search. So here's our first search term. I'm going to do my, oh no, where'd it go? Oh, it looks like all of my other searches went away. Well, that's unfortunate. So we can just do this pretty quickly here. So I know bone wire is a mesh. We'll make it an OR. Sorry, it's usually, I actually had this done ahead of time, but it looks like it's not really working. Kirschner wire. And these are just my keywords that I'm putting in. So we're going to change this to ORs. So let's say we just did this many for the sake of time. So here's my second search term based on my second theme. Okay, so theme number 1, theme number 2. And now we'll do arthrodesis. I know that that's a mesh term. We're also going to make it a keyword. We're also going to say fusion. Some people call it fusion. We'll say joint fusion. And that's all we're going to do for our keywords for the sake of time. Search. So here's your third search term. So now you have 3 search terms for 3 themes. And the only word you see in between is OR. So now we're going to add these to our search builder because we have our 3 themes. And that is the only time we're going to keep the and in there. So we're looking for theme number 1 and theme number 2 and theme number 3. Search. This is your final search. 151. That's not many, okay? So this is an example of how not robust the foot and ankle literature is. There's really not a ton of literature on just like foot and ankle stuff in general. So 151 is not a ton, but a lot of times this is kind of what you're going to see. Typically, you want to see hundreds and hundreds of search results in your first search. Over 1,000 is actually kind of ideal because you want it to be comprehensive and you don't want to miss anything. So what you can do if you're not satisfied with this, which honestly, I probably wouldn't be, but again, this is also just an example. You want to go back to your search terms table, make sure that this is comprehensive. Did you include every keyword that you can possibly think of? Now, some of you might be able to think of some on the fly and add to this. This is not a solo project. You absolutely need to ask other people for their input in this and see if there's other synonyms they can give you. This is when you need to go to a librarian. Sometimes they know what mesh terms to use, they know what keywords to use. Go to your experts in the field, go to other people in your group. One person should not create the search terms by themselves. This absolutely needs to be created by at least 2 people looking at it. But if you want to expand the search, so if I think that that's too narrow, then I can actually pull out one of my themes. So let's say I'm just going to pull out, let's say I'm going to pull out bone wire. So let me just go with my hammer toe theme, and I'm going to go with arthrodesis. We'll see how many I get with that. 1,400. So that's a little bit better, but you see, you're getting like thumb and all sorts of other things. But this is better than 100. So I would probably stick with something like this to be a little bit more comprehensive. And then when you go through your search, it's going to take a little bit longer because you're going to have to narrow it down, but it's better to narrow it down than to forget studies. So let's say I'm pretty happy with this. I'm going to go to send to, and you can go to file, and the format can be Medline. And this is going to save it as a TXT file, so in Notepad, so TXT, Notepad, and usually a lot of different programs can open that kind of thing. I actually have a software program that I use, so I'm going to go to Citation Manager and I'm just going to give you an example on how to do this, just kind of from start to finish. So I'm going to do that, and I'm going to open it with my software program. And I already have some articles in here. So I have 400 total, and I just imported 200. So you can see that we actually have 1,400. So you're going to have to go back down here, Citation Manager again, number to send 200, but we're going to start from citation 201, and we're going to send it again. And you keep going and going and going until you have all 1,400. So that actually can take a little bit of time. So now that I have all of my references in one place, because pretend like you have searched multiple databases. So let's say I searched 3 or 4 databases, all of my references have been uploaded in here. Now, different databases are going to produce a lot of the same literature, but they're also going to produce new, unique articles. We don't want a bunch of duplicates, we just want the unique ones. So some of these software programs, you can actually highlight all of them. In mine, you can go to References, find duplicates. Oh, well, that's surprising. But typically, you're going to have hundreds of duplicates. Granted, we only searched one database, but if you were to put many in here, you would have like hundreds of duplicates. And then you can get rid of them all in a software manager. Now, you need to keep track of your duplicates because you have to report them in your Prisma diagram. So don't just get rid of them and forget about them and never document them. You have to document that later. So that is basically the search that you do. The only thing I would add is definitely don't do this solo. Make sure that you're running the search terms table by other people, and try to include all of the keywords that are possible. So this is not an exhaustive list. You know, you could probably think of other things here, but for the sake of time, I just kind of made this on the fly. So I do want to pause and see if you guys have any questions about the search, because my understanding is that the search is something you guys are going to be doing kind of on your own. And since I'm sharing my screen with you, I actually can't really see you guys. Let me go here. Does anyone have questions?
When we keep track of duplicates, do we just need to keep track of like how many it is, or like the specific, like the hundreds of them, like the specific names of them and everything?
Just how many?
Okay.
Dr. Albright, go ahead.
What's the importance of keeping track of the duplicates?
So it's just for your Prisma flow diagram. I can pull that up real quick. This is an example of your Prisma flow diagram, and it asks for how many unique records you found. So some studies will say we found 10,000 articles, but only 500 of them were unique. So it makes it look like they did a really comprehensive search when they actually didn't, because they only had 500 unique ones, but they didn't report how many were unique. Does that make sense? So it's just being transparent and saying, this is how many articles we found because we searched multiple databases, but this is how many were actually unique. And it just wants you to report that for transparency.
Okay, thank you.
Quick question I had. So the idea of having multiple people come up with different search terms is that you increase the variety and combination of terms. Is that it?
Yeah, basically. Different people are going to come up with different ways to say something. So, for example, in podiatry, we often say BKA to refer to below knee amputation, but the orthopedic literature often refers to it as transtibial amputation. So if you were to come up with the search terms by yourself, you might just say below knee amputation, lower extremity amputation, and not think of transtibial. You just talk to one other person and they'll give you the idea of transtibial, and now you can include that and you'll pull even more literature. It's just to bounce ideas off each other.
Okay. All right. Thank you, doctor.
Sure.
Question, Rachel. Is there an alternative? I saw you using EndNote. I don't know if all the students are going to have access to it. I know you said in PubMed or Medline there are other ways to do it to keep track of all your articles.
So you mean keep track of the references?
Yeah. When you're ready to get the full list of all of them.
So EndNote is just a referencing software program. It's like RefWorks. I think the RFU students have access to RefWorks. I believe it's free. So you guys can upload all of your references into RefWorks instead. I believe you would want to use the TXT file though. You can use the Medline format and it'll download it as a TXT. And I believe RefWorks will accept that file and you can just upload it in there. But I don't use EndNote to actually go through my search and organize my articles. I actually use a different program for that, and I'm going to show you guys that. Does that answer your question?
Yeah, I think so.
Anybody else? If not, we'll move on to organizing the articles once you feel like you have them all. Okay, so let's move on. So let me just make sure I didn't want to say anything in my PowerPoint. Okay. So now we're going to move on to reviewing the articles. So you have 1,400 articles you're going to review. There's several different ways to do this. Typically, people do 3 reviews total. You can do less, you can do more. It's going to be based on how organized you want to be, how many people are on your team, just how feasible things are. But typically, people do around 3. The first review is a title abstract review. This is really quick. You just are running through and you're eliminating articles that are clearly off topic, okay? If you're only looking at the toes and there's articles on the fingers, eliminate them immediately and keep track of how many were eliminated in that. And then in your Prisma diagram, it just says how many were eliminated via title abstract review, and it'll be like 500, whatever. This is obviously like articles that you don't want to include. Any article that's kind of unclear could be helpful. You need to keep it. Again, this is a comprehensive review. Don't exclude articles for no reason, and don't exclude articles if you don't 100% know they can't help you. So the first review is pretty quick. You're just eliminating clearly off-topic articles. The second review is when you're really actually looking at the title and abstracts a little bit further, and you're trying to see if it has your inclusion criteria. A lot of times from the abstract only, it's not going to be clear. The abstract is not going to tell you enough information for you to determine if it should or shouldn't be included. And so in those cases, you're just going to keep that article around. And then the third review is your full text review. Hopefully you've limited it to maybe 100 or less articles at that time. Ideally, you'd like it to be less because you're literally reading the full text of 100 articles and that takes forever. But this is your last chance to vet these articles for your data analysis. Every single article that gets past your full text review should meet your inclusion criteria, every single one. So this is when you're being real strict. All these reviews should be blinded. Other people on your team should be doing these reviews alongside you, but they should be doing it independently, and you should have no idea what they think, and you should not be conversing about their opinions on the reviews. So after the reviews are done, like just this first review, so after you complete review number 1, you meet together as a team. So the 2 reviewers, there should be 2 minimum, by the way. So the 2 reviewers that went past the first reviewer will meet with a third person, and that third person is going to act as kind of a tiebreaker. And you guys are going to decide which articles are going to move on to the second review. Okay. So let's move on to the actual review. So I use this website. It's called Rayan. The website is rayan.qcri.org. This is the just login for it. So I'm going to log in. It's free. Everyone can access it. You just sign up for it. I will say it's a little bit glitchy. Okay. I don't know why, but it is. But just be patient with it because it's actually a really nice thing. So I'm going to go to new review. So this is what you guys are probably going to do. And this is just a test review, create. And then this is where you're going to upload the files from your software manager, either RefWorks, or you can upload the TXT file. So it does say that it'll take TXT files directly from PubMed. If you don't have a reference manager and you just have no way to organize these references, you can upload it straight from PubMed, and you will have to deal with your duplicates in RAN. Now, RAN's not perfect with dealing with duplicates, I'm going to tell you that, but you can deal with it in RAN. So I'm just going to upload just kind of some random references here, just to show you guys kind of how to do it. And now here they are. So it's only uploaded 200. This is just an example, but really you want all of your references in here. Okay, so a couple of things we're looking at here. So let's say I'm doing my first phase of my review. So that means I'm just looking at my titles and abstracts, and I'm eliminating articles that are clearly off topic. So let's kind of do that. Now, this is talking about calcaneus fractures. Clearly off topic, right? Because I'm only looking at hammer toes. This is talking about digital ulcers in the arteries. Clearly off topic, right? Plantar plate injury. Maybe, right? Plantar plate's near the toe. It's possible. Wires versus implants. Definitely. We want to look at that. So do you see how fast I'm going through this? This is not taking a long time, and we can tell pretty clearly this does not help us versus this might help us. Methotrexate, no. So this is just very quickly title abstract review. You should have thousands, hopefully, or at least hundreds that you're going through, and you're just going through real quickly. Now you want to have a really low threshold for inclusion. You know, if something is kind of on the borderline, include it. You can't exclude things too quickly, and you're going to be tempted to do that. You're going to be tempted to be like, well, this is talking about the FDL transfers for this type of hammer toe, and I'm only looking at fixation. I'm not looking at FDL transfers. Include it anyway because it's talking about toes. Maybe they'll talk about fixation in there. Just be generous with this first run through because you're really only taking out stuff that is obviously not going to help you, okay? So that's your first run through. Now let's say you're done with your first run through. I'm going to go back to all reviews and do one that's kind of already been done. Okay. So let's say you've done your first run through, and I've decided I want to include 140. And this is how much, so these are the ones that I want to look at again, more in depth, okay? So there's a couple ways to go through this. I guess I didn't really show you these buttons, but this should be pretty self-explanatory. If you want the article, you press include. You don't want the article, you press exclude, and then maybe just makes it white. So it turns white, has your name there, and you can go back to it later. These reasons and labels are really helpful, especially in this second portion of the review. So this is where I'm getting a little bit more in depth. I'm actually going to read the abstract a little bit closer and see if this meets my criteria. So let me go to just some excluded ones, for example. So here's an example where I said it had the wrong outcome. Okay, so I read through this abstract and I said that it did not meet my inclusion criteria because it had the wrong outcome. So that's what these reasons are. It's a way for you to label your articles so that you know why it got excluded in this second round of reviews. So there's all sorts of things here. These are mostly for intervention studies. That's why it says wrong drug. Obviously, that's not going to apply to you guys. You can just change it. If I want to add it, I'll just say from surgery. And then I just press it, and there it is. If I want to take it away, I just press the negative, and it goes away. So that's how you do reasons. Labels, let's say I know that this should not be included, but I think it might be helpful to go back to it later because it looks like there might be some good references in this article. Because remember, we want to look through the references too and make sure we're not missing something. I'll just label it references, click on it, and there it is. Now, the nice thing about RAN is all of your labels are here on the left. So scroll down a little bit. Here's all my labels that I've made. So For this example, I labeled things based on the study design. So these are all the retrospective cohorts that I included. Now, the reason why only 2 are coming up is because you'll notice that I'm in the excluded portion here. So it's it's filtering excluded and it's filtering retrospective cohort. So if I want to look at only retrospective cohorts, I'll just press clear. And now it gives me all of them that are labeled that. So just be careful with that. You might notice that only 1 article is coming up here, and it's because you have an extra filter there. If I want to clear that filter out completely, just press clear. And it'll just give you all the studies now. So labels are really helpful, and they're right there on that left-hand side. It also gives you some other things that are kind of helpful. Sometimes it'll tell you the authors or the journals that are included in it. So this sidebar can be helpful. So that's a little bit how you use this software program to help you organize your ideas. Now I want to show you something. So in this as an example, I have several people included on this review. These are all my co-authors on this review. You'll only see this if you have other authors that you've invited to your review. So for example, the new one that we just made, I'll show you what that looks like. I haven't invited anybody to it, so it's just me. Like there's no one here. But on this review, there's several people on it, so I'll see who they are and what they've done. But the blinding is on, okay? So blinding is decisions and labels of any collaborator are not visible to others. I can see how much progress they've made, but I don't know their individual decisions on which articles they want to include or exclude. I know that this person, well, this person wants to include 104 and I want to include 139. So you can kind of see how there's differences a little bit between the people. So do the first round of reviews blinded. Don't look at what anyone else is doing. When you guys are done with the first review, you click blind. Are you sure you want to unblind it? Yep. And now the blind is off. So now when I go back into it, I can see what all of my co-authors have done. And I can see all the labels they've done and I can see what they think about it. So it's important to not be influenced by your co-authors, just do this on your own. So I can go to conflict, and this will tell me only the ones that we conflicted on. So for this one, only 1 person conflicted, 1 person, but this is kind of down the middle. 3 people thought yes, 2 people thought no. These are all the conflicts you got to go through as a group and find a consensus on if you're going to include it or not, okay? Once you click a label for it, so if I decide that these are all the ones I'm going to include and they're all green, a lot of times I'll make a new review just for these articles to kind of organize my thoughts. So you'll see that I actually have several reviews here, and some of it is just to organize my thoughts. So this was my initial review. I had 2,000 articles. And then this is a new review I made that only has articles left after title abstract exclusion, because I didn't want to go have all 2,000 available to me. It would confuse me to see all of those. So I just lessened it to 180. And then after that, this is how many we need to do full text on. Full text reviews, 35 from the 180. So do you see how I kind of made new reviews each time I was at a new step in my review process? So that can help you too. Again, you don't have to do that, but it might help you with organization purposes to just kind of start from scratch. So that's basically how you use Rayon to organize your thoughts in this review process. I do have some tips for how to do this. So 3 reviewers is the minimum. Okay, this isn't a solo mission. You have to have 2 minimum that are going through all the articles, and then the 3rd person can act as a mediator. You might use more people if you want. You don't have to use a reference manager, but I would consider using one. Because it helps organize everything, and a lot of times you have tons and tons of articles. Keep track of your duplicates. I talked about that before. Use labels, because every article that you exclude needs to be accounted for. And I recommend a little pearl is to have a master file of all the references that you pull and never modify it or touch it. So when I go through 3 databases, I'll put it all into one master file, label it master file, and then never open that again, because just keeps track in case you ever do have to go back to it. There was one time when I was publishing a meta-analysis and they asked me why I didn't include certain articles, and the only place those articles existed was in my master file. So it's helpful to have a master file just in case you do have to go back to the beginning for some reason. And then I had several smaller files for other separate parts of my study. So I'm going to pause here, I think. Oh, I can't get out of this. There we go. And ask you if you have questions.
Yeah, it would make sense maybe that the mentors that have students working on systematic reviews, meta-analysis actually serve as the owner, and then they can blind and unblind and invite people to join in. I think that's probably the right way to do it. The mentors might be more likely to have EndNote too, so they could get rid of the duplicates after the initial searches. That makes a lot of sense, although I think we should ask our librarian if there's a way to Charlotte or whoever's doing it to get rid of these duplicates in RefWorks. I don't know if it's possible or not.
Can get rid of them in Rayon, but it's a little bit annoying. I can show you that. I don't know if there's going to be duplicates in this one, but it would show up. It shows up here, duplicates. So these are all of our unresolved duplicates. And if there's a thing here, I guess this is like a tag saying this is a duplicate. So when you click on it, you can click resolve duplicate and it'll show you both of them. So this is the first one. This is the second one on top of it. And it tells you that they're 98% duplicates. So you can actually look through it and decide if it's a duplicate. But you can see how labor intensive this is. You're literally going through every single duplicate yourself and deciding if it's a duplicate. So you can use Rayon for that, but it's kind of labor intensive.
Other reference method that I use is Mendeley, and it's free. And actually that can get rid of the duplicates.
Wonderful. Yeah, there's a lot of free versions too, so definitely explore the free ones. Any other questions about this portion of it?
So you mentioned you can do this with a minimum of 2 reviewers, and then the third will resolve conflict. How do you, does that third reviewer only get invited to look at the conflicting studies then?
Yeah, typically.
And how do you do that? You do that in that software too?
Yeah, so you just blind everybody. Like everyone will be invited at one time. You blind everybody, and then you guys can Google chat just like we are, share the screen, and just go into that conflict session and go through it. I mean, you can use more than 2 reviewers. Like the systematic review I did, we used 5 actually.
So Noah, I mean, the person who resolves conflicts can be on it the entire time. They can have access to the entire program and all the articles, but they would only be, kind of invited to participate when the conflict has to be resolved. But I would probably recommend that the 2 students go through the articles on each of the products, and then for the conflicts, they resolve them with their mentor or mentors, in a combined session.
How does an article end up in one database but not in other? And how do we know that we've done a comprehensive review?
Yeah, that's a good question. So some articles are indexed in different databases. It's typically, I'm not an expert with how articles are indexed, but I want to say that different journals are indexed in different databases. And the journal usually tells you what database it's indexed in. That sometimes influences which journals people want to publish in based on what it's indexed in. But Medline is a very common database that's used. Medline is the same as PubMed. Ovid also uses the Medline database. But you just want to be as comprehensive as possible by using as many databases as possible. How do you know that you've truly been comprehensive? When you're not pulling any new data. So down the line, as you keep going through this, you're going to look at the references of articles. You're going to just come across new articles. Go back and make sure that those are included in your search. And if you're finding a ton of articles that were not included in your initial search, you probably weren't comprehensive. If you find one or two, you're probably still okay. But you just do the best you can, and you take every step you can to be as comprehensive as possible. But obviously, none of us are perfect. So
we should probably just move into the analysis, the RevMan.
yeah, I only have 9 minutes left,
Yeah.
so I don't know how far I'm gonna get with you guys on this. I apologize for being so slow. So I'm just gonna skip all of this and let's just go into RevMan completely. So this is what RevMan looks like. I did send you guys a step-by-step PDF on how to use this. But one thing I want to show you is go to Tools, go to Preferences, and make sure this is clicked off. You want it to be non-Cochrane mode. So do that. You'll thank me later. So File, New, and this is going to bring you to your review wizard. Okay, it's real easy. Next, let's say I want to do an intervention review. That's what I want to do for my research question, because remember, I'm looking at K-wires versus implants. You can choose diagnostic test, accuracy review. Some of you might be doing that, but we're going to do an intervention review. This is kind of closer to what my research question is. So I'm looking at implants versus K-wires for hammer toes, and we're really looking at arthrodesis. Okay, next. And you're going to click full review. If you click protocol, it'll just bring you through a bunch of steps that aren't going to be applicable to you. So just press full review, finish. Here it is. I'm getting rid of this because it's kind of in the way. So on this left-hand side, this is kind of what you're going to use here, but everything you click over here kind of shows up in this space here. So I'm going to go to studies and references. Another way to get to this is to just open up this key here. And if you go to references to studies and open that up, here's included studies here too. So you can access it through this area or this area. We just press add a study. And I usually do the author and then the year. It's just easier, but you can do it however you want. We're typically going to look at published data. But remember, if you did look at abstracts, you can do unpublished data. But typically it's going to be published data only. Here's the year already put in for me. And then I'm going to add another study in the same section. And it lets me just add more studies. So we'll go through that real quick. Let's add one more. So pretty simple. I'm just going to press finish. So I have 3 studies here in my section. So if that's all I want to add, then you go down to data and analysis and you press add comparison. So what name should the comparison have? You can just say K-wires versus implants or whatever your comparison is. What do you want to do after the wizard's closed? I want to add an outcome. Okay, continue. Now, this is where you might need your research mentor's help. What type of outcome do you have? So dichotomous outcomes means that did the person have the outcome, yes or no? It's just going to be a yes or no kind of question. And it's going to ask you for the total number of participants with the event, the total number of participants without it, and in each group. So I'm going to click that one, but a continuous variable, you have to have the mean and standard deviation, and then the total population number. O minus E is observed minus expected, and the variance probably won't be using that. This is using an effect estimate, which again, you probably won't need that because most of you are just going to do dichotomous or continuous. And then other data, I would avoid using this because this does not pull any algorithms really from the review manager. So you have to do everything by hand on your own. So I'm going to click dichotomous because my outcome is, did someone achieve an arthrodesis? Yes or no? Next. So I'm just going to give it something random. We'll say my experimental group is implants. Control group is K-wires. Okay. Statistical method. So most of you, if you have a dichotomous outcome, are going to use the mantle. Pito is a way to pool odds ratios. I would check with your research mentor before using this. This is kind of the standard. Pito does have issues with some bias, especially if the groups are a lot different. There's a lot of different if the sample size is different between the groups, this will give you bias. So stick with Mantle. The analysis model needs to be random effects, okay? Fixed effects is only used if your summary estimate is exactly the same every time, or if your effect measure is exactly the same every time. So just use the random effects, it's more conservative. Odds ratio versus risk ratio, it's going to be based on your study design. So ask your mentor for that. I'm just going to choose risk ratio. And then typically you're going to use a 95% confidence interval. Okay, so I do want to show you this part. We'll say implants. The control group is K-wires. I'm gonna say nothing. Okay, so here's my outcome. I'm gonna right click it and press add study data. And now these are all the studies I put in the included studies portion here. So any study that you think has data, you're going to just highlight them and press finish. So here you are in RevMan. And there's two ways you can import the data. You can either click right in here and import it just right in here. So let's say 90 out of 100 people achieved fusion, or you can go to the calculator and put it in here. And let's say for the K-wire group, only 85 out of 100 achieved it. So this is a little bit more confusing because there's like a lot of numbers here, but some people want to see the details of all of these numbers and how RevMan is deriving it, but you don't have to do it this way. I usually don't do it this way. I just put it right into the table because I think it's easier. Now, when I add this in, here is my effect or my risk ratio, my estimate here, and it's added right to my forest plot. So I'm gonna just add random stuff. This is no meaning to this, it's just is what it is. We're gonna make this K-wire group actually better on that one and see what happens here. Okay, so here's our forest plot. If you click on this button right here, it gives you the forest plot a little bit bigger. So this is exactly what Dr. Rosenblatt was talking about before. For this is a risk ratio. So remember what type of estimate you're using, or this is a risk ratio. So 1 means no difference, okay? Anything this way means that you have a higher likelihood of getting the event. Anything this way means you have a lower likelihood of getting the event. Now, I'm hoping there's something clicking in you guys that there's actually something here that doesn't look right. And because we don't have a lot of time, I'm just going to tell you, this label should look wrong to you. Do you notice that 15 out of 20 had the event here, had arthrodesis, and only 5 out of 30 here, but it says that it favors the K-wires? So this is because when you're using dichotomous outcomes, typically events are bad, right? We're typically looking at death, heart attack, how many people are dying. So it's just, the standard is to assume that the event's bad. So go to your settings, go to graph, and just change it. You just need to change this to K-wires. This is the left graph label versus this to implant. So just check these labels and make sure that they're right. This sounds more right. So just do that. So it's actually 12 my time. So I don't know if you want me to, what you want me to do. Should I keep going? Should I just stop?
Karen, I would defer to Karen. I know they have a school kind of grand rounds type presentation this time.
Do we want to schedule perhaps like another hour or some or whatever time you think you might need, Dr. Albright, a different day to finish this, because this is really important information. The students are I'm sure will be very beneficial to them.
It's up to you guys.
Yeah, we probably will not. I think we should probably end here. And
Okay.
we can, I think the students have enough to go on. We have a schedule of events that we want them to get through by the next week. And we can again, when we get it towards the analysis part, if Dr. Albright has time, we can ask her to come back and maybe help us understand RevMan a little bit better. That'd be great.
Dr. Albright, thank you so much for your time and all the effort you put into this. We truly appreciate it.
Yeah, it's my pleasure. I'm sorry I didn't get through everything. It's just so much information for you guys, but hopefully it helped.
Great stuff. Great stuff.
All right. Well,
how do
thank
we
you guys.
access these recorded lectures? Is there a way we can access this lecture that we just saw?
Yes, well, definitely we can make it available. I know it takes a while for it to get uploaded to our drive. So when it is, we can definitely let you know.
Okay, thank you.
Any other questions? Anybody?
I'll be sending out an email to my mentors. I'm sure the other mentors, or to the mentees, the other mentors will do the same. Again, to get everybody on the same page, so we have some general timelines we're trying to meet. So really, by next week Monday, we'll try to have most of these articles for your individual searches uploaded into RAN, hopefully. Yeah, we'll kind of go from there. So thanks again. And if you can join in the grand rounds, do that at this time. I think that'd be great. Right.
Okay, great. Thanks, everybody. Thanks again, Dr. Albright.
Thank you.
Thank you.
Thank you.
Thank you, Dr. Albright.
Thank you. Thanks, Dr. Albright.
Thank you. That was great.